everyone, I'm Renee Mehrra and welcome to Your Health Matters, our innovative health series creating awareness on critical public health issues so we understand the importance of early detection and prevention. Today we're going to be talking about a very critical public health issue with a very well-renowned doctor, Dr. Seeth Vivek, and we're going to talk about mental illnesses, especially in the South Asian community, and we want to destigmatize this issue. Dr. Seeth Vivek has been practicing psychiatry for 4 decades and in private practice in Queens, as well as he's the chairman of Psychiatry and Addiction Services at Flushing and Jamaica Hospital. He also is a professor and chairman of psychiatry at Ross University Medical School. Thank you so much for joining us today, Dr. Vivek, and I've known you for a very long time. Mental illness is all around. I mean, in USA, we see 1 in 5 adults in every year being diagnosed with mental illness, and 1 in 25 adults every year in US for serious mental illnesses. So this is a very critical public health issue, and especially in our South Asian community, we don't talk about it. We feel guilty, we feel ashamed. There's a lot of stigma attached to it. But it's the same thing whether you have a physical ailment or you have a mental ailment. You have to go to a doctor early so that we're able to see that it doesn't escalate. So tell us, first of all, Dr. Vivek, tell us about mental illness. There's so many, starting with anxiety disorders, ADHD, mood swings, schizophrenia, bipolar. So share with our viewers all these mental illnesses.
Sure. Renee, first of all, thank you for having me on the show. And thank you for focusing on such an important topic. It's one of those issues that gets pushed under the rug. People are uncomfortable talking about mental illnesses. If people have a physical illness, if they have a broken bone, there's no hesitation talking about it. But if there's depression in the family, people hide it. If there's somebody with schizophrenia, or if they have a kid who's autistic, that becomes secretive. Unfortunately, that then leads to this cycle where people don't seek help. And this is especially tragic in those conditions that are treatable. There are many psychiatric illnesses where you can get full remission. And so the fact that you are raising awareness is wonderful. I want to thank you for that. In the South Asian community in particular, the stigma is very high.
We're looking at schizophrenia or bipolar. Share some of the symptoms, what happens?
So there are different syndromes in terms of psychiatric illness. There are some that are more easily recognizable, some that are considered more they're closer to normal behavior. And then there are some that are very serious. So let's start at the serious end of the spectrum. These are often called as SMIs, or serious mental illness, severe mental illness. So schizophrenia is a condition where a person experiences hallucinations and delusions. So hallucinations are when people see things that don't exist, or they hear things that have not been said.
This is like mental psychosis?
Yeah, that's called as a hallucination. Yeah, so that psychosis is a general word. When a person loses touch with reality, that's called a psychosis. So in schizophrenia, the main symptoms are hallucinations, when you see or hear or smell things that don't exist, or delusions. Delusions are when you have a firm belief in something that is not based in reality. So for example, if a person insists that the CIA is out to get them, right, or they believe that there is some alien force that is controlling them, or that their neighbor has a machine in their apartment that is controlling their brain. So hallucinations and delusions are the 2 common symptoms of schizophrenia.
I see.
Now, schizophrenia affects about 1% of the population, anywhere in the world. The US, India, Thailand, everywhere. It's approximately the same, about 1%. Then you've got bipolar illness. Bipolar illness is what used to be called manic depressive illness, where a person's mood is either high, they're euphoric, for no apparent reason. They got lots of energy. They don't need sleep. They're spending a lot of money. They're talking a mile a minute. And that alternates then with depression, where they don't feel life is worth living. They're sad. And the worst case scenario, of course, is when the person becomes suicidal and actually completes a suicide. So schizophrenia and bipolar disorder are two of the commonest illnesses in the serious end of the spectrum.
And then we go to something less serious, and most of us go through anxiety disorders,
Exactly.
So
for example, anxiety disorders. Now, anxiety is a normal part of life, but it becomes a disorder. You would call it an anxiety disorder when it interferes with our day-to-day living. So, for example, being a little queasy about certain things would be considered normal, but let's say you have a fear of flying.
Yeah, I was about to ask you that.
And your job requires you to fly. Okay. So then it becomes an issue. So a phobia, a fear. So for example, if you're afraid of snakes and you live in Manhattan, who cares? It's not something that you're going to deal with. Okay. But on the other hand, if you live in a high rise and you're afraid of elevators, okay, or your job is on the 40th floor of a building, but you can't get into an elevator. So then it becomes, that phobia, that fear becomes an issue in your life. There are other anxiety disorders such as panic attacks, panic disorder, obsessive compulsive disorder, post-traumatic stress disorder. And these are all conditions that are relatively common. And people tend to conceal them. They don't talk about it. And if only they would, there's a lot of help available.
You talked about post-traumatic stress disorder, that PTSD is now becoming it's all over. We're talking about it all the time. How do we address that? Because a lot of people are mentioning that they're having this issue.
Yeah. Now, PTSD has had all kinds of names over the years. After the Vietnam War, the term PTSD kind of stuck because many of our returning veterans, so for example, what would happen is they would hear a sound and they would just dive to the floor, or they would be sweating. It was as if they were in combat. But PTSD is not limited to veterans. PTSD can happen to anyone that has been exposed to severe trauma.
So it could be a little child as well.
Exactly. So for example, a common scenario is somebody who was assaulted, victims of sexual abuse, people who have been in hostage situations. Anything that was outside the realm
Any
of
school children, witnessing shootings.
Absolutely. So PTSD is a condition that is treatable. Primarily psychotherapy. There are different kinds of psychotherapy, and some patients require medications that benefit them. So usually a combination of talk therapy and medication therapy is what helps.
Depression, when does it become a major issue and interferes in our lives? Because all of us go through some depression.
Absolutely. No, that's great. So for example, a certain amount of sadness could be normal. Somebody has a breakup in a relationship. Somebody loses a job. Somebody loses a loved one. To feel sad would be normative. But let's say 6 months later, a person is still sad, still depressed, crying all day long, okay? Not able to get out of bed, feeling that life's not worth living. They're not able to focus at work. They're not able to concentrate. Now, those are what are called the signs and symptoms
of depression.
Of major depressive
So
disorder.
hold your thought on that. I'm going to be taking a quick break. When we come back, we're going to talk to Dr. Vivek about depression as well as South Asian community and mental illnesses. Stay with us. We're back and we're talking to Dr. Seeth Vivek, who's been practicing psychiatry for 4 decades. Dr. Vivek, we were talking about depression, and pretty much everybody goes through it on a regular basis, but when do we actually see a doctor?
So 2 things. when the sadness and the depressive symptoms persist. So
they can persist for a week?
No, anything, yeah. So the diagnostic manuals say 2 weeks, but I mean, that is just an arbitrary number. But in general, if symptoms persist for longer than 2 weeks, or if symptoms are debilitating. So for example, if you lose interest in eating for a day or 2 or 3, that's fine. But if 3 weeks later you're still not eating, you're losing weight, okay, that should be something to be concerned about. If you have insomnia, you can't go to sleep for a couple of nights, that may be normative. But let's say you suffered a loss and 6 months later you still can't go to sleep. Or you're having nightmares. Or you keep wondering about whether life is worth living. And you keep thinking about maybe it would be okay if I didn't wake up tomorrow. So when a person's thinking or functioning gets to the point where they are not able to cope with life on a day-to-day basis. Now, depression also impacts people in other ways. For example, a mom who's depressed is not going to be able to take care of her little children. So you're not a good parent. You're not able to be a good spouse. And so it affects marriages, it affects jobs. People don't perform well at work. They end up losing their job, which then gets them even more depressed. So it is imperative that it gets treated early, before the consequences of depression affect you even further.
But many times a person may not be aware of that they should go and see the doctor and the symptoms are escalating. The caregiver or people around that person, the family members, should be noticing and observing this?
Yes, and that is where the role of family comes in. That is where education is important. And that is why I'm always happy when a celebrity comes out and talks about their depression. It makes it okay. So then the spouse is able to say, honey, what you're going through is what celebrity so-and-so went through. I think you need to get help. Sometimes because either people are macho, especially so for men, who they view depression as a sign of weakness, so therefore resist going to a doctor, or a matter of shame. For example, there are in many of our immigrant families, I've heard people say, well, if we admit that there's mental illness in our family, then our daughter won't get married. And you know that there would be, nobody will invite us to social events anymore, or they will look askance at us. So the idea that these are treatable conditions, for the most part, depression is almost 100% treatable in this day and age.
But then if it's treated early,
yes,
that's the most important part.
If it's treated early, then you don't suffer the secondary consequences of depression. Because depression that starts as mild depression can become severe depression, and severe depression can then become suicidal depression, where people not only are suicidal, some are even homicidal. So they hurt themselves and they hurt others.
Is it genetic?
Some depression is. Some depression is genetic. So for example, in the Hemingway family, Ernest Hemingway, the author, 9 generations of the Hemingways, there's a suicide in those. So yes, some depression can be genetic.
And it can be triggered off by an environmental stressor.
Yeah, but it's not always genetic. It often is related to actual losses in life. So you could have somebody who doesn't have a family history of depression, but if they suffer a disappointment that is severe enough, they can then have a depressive episode.
So mental illness as it is difficult sometimes to address and to cope with. And now we're dealing with a South Asian community where there's a lot of stigma attached to it. So it's exacerbated. So
absolutely.
How do we address this? And you being a Asian Indian, you have a lot of patients who are South Asian. What do you see? What are the barriers?
Many South Asians are very comfortable with physical symptoms.
Yeah.
So they'll come in with multiple aches and pains, and they'll say that their medical doctor couldn't find anything wrong with them. So all their blood tests were normal, their EKG was normal, their x-rays were normal, and yet they've got all these physical symptoms. It's only when you probe further that you find out that there's insomnia, they're not eating well. There is what is called as anhedonia, that is, they don't enjoy the things they used to enjoy. They were crazy about movies, now they don't. They used to love tennis, now they couldn't care less. And so then you find that underlying all those physical symptoms was actually a treatable depression. Yes. You treat the depression, then all of a sudden their aches and pains are all gone. So I think for the physicians, the challenge is that when you have such a patient come in, especially our Indian patients, that we introduce the topic of, so for example, people have panic attacks, but they'll focus on the palpitations. They'll go from one cardiologist to another.
But the root cause is different.
The root cause is they're having a panic attack.
But then as a South Asian doctor, how do you bring this out? You have to really probe, investigate, and many physicians don't have that time.
Yeah, and that's a tragedy. But I think it requires a few things. It requires A, patience. B, it requires us to not be judgmental. It's not like the patient doesn't want to get better. We are all governed by our own circumstances. So our patients too, they are a product of the culture they grew up in, the parenting they received, their knowledge base. So it is important to educate them. So for example, I've had parents bring in kids who are not doing well in school. And it then requires some education to teach the parent about what is ADHD or what is a school phobia. So I think education is critical.
Absolutely, and that's what the show is all about. We'll take a quick break again, and when we come back, we'll be talking to Dr. Vivek about treatments, how do we improve them, especially in the South Asian community. Stay with us. Welcome back to Your Health Matters. We're talking on mental illness with Dr. Seeth Vivek. Dr. Vivek, we were talking about the barriers that come in the way for treatment with South Asian community because we don't talk about it, we feel ashamed and guilty, and we just suppress it, hold it down, and then it gets worse and worse, and it gets, before a physician can do anything or a psychiatrist can do, it's full-blown mental illness. Share some narratives that you have seen in your South Asian patients and how you were able to address them to come out and, say it's okay if you have a mental illness, it can be treated.
Sure. There are many examples where you've had to work through the belief system that the patient and the family have had. Sometimes it's, to a Western mind, it's almost outrageous, some of the things that our patients will say. It's not outrageous in the Indian context, but it is outrageous here. So for example, in the arranged marriage scenario, some people are under the impression that the cure for the mental illness is to get somebody married. So we've had a young man with schizophrenia or a young woman with, say, a mood disorder. That information is concealed from the prospective spouse, and it usually ends in disaster because A, marriage is not a solution. If anything, marriage brings with it greater stresses. Now, this is in the arranged marriage context. But similarly, there are, with other aspects of psychiatric illness, where people will go to great lengths to conceal what the family member has. So oftentimes it requires not just dealing with the individual. In a Western context, for example, in individual psychotherapy, I'm dealing just with the patient. In the Indian context, I have to often meet with not just the patient, but sometimes 3 generations. You got to bring in the parents, the spouse, sometimes an adult kid, and you have to educate them about. Let them know that A, it's not contagious. B, it's treatable. C, there is no shame to it. Sometimes you have to describe celebrities and others who have had that. And I've gone to the extent of sometimes bringing in people's priests. So I've had the priest say to the patient, it's okay to take the medicine. It's okay to go talk to a therapist. It's okay to describe such and such. So it's the education, it is going the extra mile. And then there are certain things, though, which many of our Indian patients find it easy to accept. For example, if you suggest meditation, suggesting yoga. With my Chinese patients, I ask them to go do Tai Chi. So I think that is a good entree. Most of our patients need more than that. They might need psychotherapy, family therapy, and
music therapy,
art therapy.
But when you talk about meditation, I just wanted to pause here a little bit. There are scientific studies, because I'm a big believer in that there are scientific studies, besides being a believer, that you know, with meditation, your stress levels go down.
Absolutely.
Everybody knows that. Your alpha levels go up and your beta rhythms go down. And your thought processes go down. You know, we almost have almost 15 to 50,000 thoughts daily. The thoughts go down.
Absolutely.
And it's a quiet, relaxed state of mind. This can be an adjunct therapy.
Absolutely. For milder conditions, it may be the only therapy.
Exactly.
So, for example, mindfulness has become, you know, a common term used today. So, meditation has now been proven to have physiological correlates. So you can actually see the difference
between a meditative mind and a non-meditative mind. And the gray matter is not related to age. It can happen to anybody, young or old.
Absolutely.
And that brings that, you know, the gateways lit up, the brain waves are relaxed. So there's a whole lot of activity that has been reduced.
Absolutely.
So you do recommend that to your
absolutely,
patients?
all the time. So meditation, yoga, then along with that, talk therapy when it's necessary, and when necessary, medicines. Because for some people, all of this alone is not adequate. If you combine it all, it makes the difference.
So, you know, like detoxifying mentally, meaning they can talk to you about it, what happened, they can go back to their childhood, this is what happened, this is what disturbed me, and now I'm having these issues, maybe. But then do we have time to listen to psychiatrists really? Do you give that much time to your patients?
Well, that is what psychiatry is. One has to deal with that. Now, one important topic we didn't talk about today. Today, substance abuse is a huge problem, not only in the larger community, but also in the South Asian community. So, alcohol abuse, opiate abuse has become very rampant. And I don't think the South Asian community is immune to it. They don't talk about it. And yet it's critical that we do. But you're right. I think shows such as yours and journalists such as yourself have such a huge role to play in motivating our communities to get the necessary help in a timely way.
Exactly. So when you're talking about addictions, and that's a very, as you mentioned, it's a very tough issue as well. We've got opioid overdose. How do you, because addictions, you know, they're not just going to go away with a magic wand. So how do you address those issues? Because the person is so definitely addicted to substance abuse or opioids. And then you have more mental illnesses along with this. It's a very complicated issue at that time.
It's very complex, but the most complex part of this is that the prominent symptom is denial. So the person who is addicted is denying it. They're minimizing it. People around them know. Yes. But the person could be drinking, you know, a quart.
And say, oh, it's
of
okay.
liquor.
I don't, get high with it. It's okay. So that you got to get them out of the denial stage.
Yeah.
It's not going to be that.
And with many people, that initial intervention becomes important.
Group counseling,
Yes.
family counseling. So when you're teaching, at Ross Medical Center as well, you're bringing these new adjunct therapies, the holistic way of looking at, at a patient.
Of course. We call it the biopsychosocial model. That for all of these illnesses, there's a biology to it,
Yes.
there's a psychology to it, and there's almost always a sociology to it.
And how many patients have been successful with your treatment?
Well, I think it depends.
Give me the success rate,
That's hard to say. It depends on which diagnostic condition. So, for example, conditions like panic disorder,
Yes.
conditions like depression, I would say somewhere in the neighborhood of 95+% respond. With other illnesses, the goal is not total recovery. It's a matter of getting them into a state where they're able to function adequately, where they're stable. They don't go back into the hospital.
Thank you so much, Dr. Seeth Vivek. And the biggest takeaway is early detection so that treatment can be more effective. I'm Renee Mehrra. Thank you so much for watching Your Health Matters. Stay healthy, stay positive.